everyone. Welcome to The Doctor is In on CNN Philippines. On this program, we hope to provide you with virtual care in this time of the coronavirus. I'm Dr. Freddie Gomez. With the easing of quarantine restrictions, most of us are now out and about. We are leaving our homes, returning to our workplaces, and engaging in our usual day-to-day activities. But we always have to remember that the pandemic isn't over. If we don't stay vigilant, our homes could be put in danger and we may expose ourselves and our families. Today, we will talk about properly cleaning and disinfecting your homes to make sure we don't bring the virus back home. Joining us is microbiologist Dr. Sharon Villanueva. She's an associate professor at the Department of Medical Microbiology at the College of Public Health, UP Manila. Welcome to the show, Dr. Sharon.
Good afternoon, Doc Freddie. Thank you for having me.
Now, Dr. Sharon, we've been thinking of ingenious ways to manipulate objects so as not to touch them with our hands. And we do this because we've learned that COVID-19 can actually live for hours to days on certain surfaces. And while this is not the main mode of transmitting COVID-19, we should still be concerned about it because you can never be too careful nowadays. So, Doctor, my question is, we have to first filter fact from fiction. How long can COVID-19 really stay on surfaces, and how possible is the transmission through contaminated materials?
Doc Fred, thank you for that question. Regarding the how long the virus or SARS-CoV-2 can stay on the surfaces, it actually depends on the materials of the on the material. So studies have shown that it can stay for a few hours on certain surfaces like papers, but it can stay for several hours and even days, 2 to 3 days. And recently, there have been studies that it can stay for as long as 7 days on steel or plastic surfaces. And then, so that's it po. It really depends on the type of
Yeah.
surface that wherein the virus got stuck.
So napaka-importante talaga yung surface, ano? At dahil
Yes po.
lumalabas na po ang karamihan sa atin, napaka-importante na dapat malinis lagi ang ating mga bahay, especially the common high-touch surfaces like tables, chairs, door handles, and computers, as well as yung mga toys ng mga bata. Doctor, how can we make our homes coronavirus proof? Is regular cleaning good enough or enough for that matter?
Yes, Doc. Actually, the WHO and also the CDC of United States have recommended that we regularly clean our houses, especially the surfaces, especially those surfaces that you've mentioned are high touch, like those that we frequently touch. So at first, it's not only spraying alcohol or spraying hypochlorite solution on the surfaces, but first we must also um, clean them or physically remove first the dirt, and then after that we disinfect them using the hypochlorite solution or alcohol, 70%, 60 to 70% alcohol po.
Ngayon, Doktor, kailan po pumapasok ang disinfection? Kasi po, magkaiba po ang paglinis, iba naman po ang pag-disinfect. So, gaano kadalas dapat yung pag-disinfect?
As much as possible, we disinfect every day. It depends also if we have someone sick at home. But I guess there's no harm in being clean or disinfecting our homes every day. So yung paglilinis po, like what you've mentioned, it's cleaning and disinfecting is totally different. So cleaning is yung ordinary na nagwawalis tayo or pinupunasan natin yung mga maalikabok na lugar, while disinfecting is you kill the germs on the surfaces by spraying yung certain chemicals like I mentioned earlier, yung alcohol and other like hypochlorite, sodium hypochlorite solution. So as much as possible, we clean all the surfaces and especially the high touch areas every day.
Okay. Okay, so ngayon sagutin naman natin yung mga social media questions natin on the CNN Philippines Facebook page. Meron tayong tanong galing kay Sel Mendoza. Ang tanong ni Sel, can you make your home can you make your home cleaning solution at home? I'm
Doc,
sorry, can you make
actually,
your own cleaning solution at home? Yan ang tanong ni Sel.
okay. The one that I've been mentioning earlier, yung sodium hypochlorite, ito po yung bleach na nasa bahay natin, ginagamit natin panglaba. But you do not use that bleach per se. So you have to dilute, imimix nyo siya sa tubig. So 0.1% is effective. Ano ba yung 0.1% na concentration? Pag i-translate mo sa ordinaryong term is around 2 kutsarita po nung bleach sa 1 litrong water. So 2 teaspoons of the bleach in 1 liter of water. And then po, please check also the label of the bleach solution that you are using. Most of the bleach solutions that we are using require that you dilute them or kailangan i-mix mo siya sa room temperature na water. Hindi pwedeng malamig, hindi pwedeng sobrang init.
Okay, that's right. So importante na hindi siya puro 2 kutsarita sa 1 litrong tubig. And always, when cleaning with chemicals like these disinfecting chemicals, always make sure na maganda ang daloy ng hangin sa kwarto or well ventilated ang inyong lugar. Okay, may isa pa tayong tanong galing kay Edwin. Ang tanong ni Edwin, is it best to keep a certain temperature at home to prevent COVID-19 from surviving?
Actually, previous studies have shown that it thrives well on lower temperatures and it can be killed at higher temperatures. Ang siguro, Doc, ang mas maiging take-home point dito is to let the air circulate in your house or even in your offices na kailangan maganda yung daloy ng hangin. As much as possible, we prevent contained or closed spaces. Kailangan padaluyin natin na para hindi nagtatagal. If ever the virus is in your workspace or in your home, para hindi siya nagtatagal dun sa area natin.
Okay, and we have one more from Asher. Tanong ni Asher, how can I disinfect my gadgets? Anong magandang mga disinfecting solutions ang pwede touch object ang mga gadgets natin?
Alcohol-based wipes can do or can disinfect your gadgets, or even if you do not have alcohol-based wipes, you can spray with alcohol. But make sure na you also wipe the surface. Dapat hindi may ipon syempre yung water dun sa surface ng mga gadgets or else masisira yung mga gadgets natin. So alcohol-based wipes or even spraying of alcohol will do. But make sure that your alcohol is at least 60%, not lower than that.
Not lower than 60%. Very good. Thank you very much, Dr. Villanueva, for sharing helpful tips on how to effectively disinfect our homes. Now, a very common question that I hear is, does COVID-19 stick on your clothes and shoes? Before we answer that, we'll take a quick break. We'll be right back on The Doctor's In. You're watching CNN Philippines. Back to the doctor's in. I'm Dr. Freddie Gomez. Before the break, we talked about how long the COVID-19 virus can stay on surfaces, as well as the risks that
Going back to
contact
our
with the virus.
normal daily routines outside our homes. But what should we do about our clothes and shoes? Let's discuss if the coronavirus can attach itself to what we are wearing. To answer our questions, we have infectious disease specialist Dr. Arthur Dessi Roman. He's also a fellow at the Philippine Society for Microbiology and Infectious Diseases. Good to have you on the show, Dr. Roman.
Good afternoon, Dr. Freddie.
Now, not everyone has access to full-body PPEs or personal protective equipment sa tuwing lumalabas ng bahay. So, Dr. Roman, can COVID-19 be transmitted viably to fabrics and shoes?
Well, Doc Freddy, yung mga fabrics and shoes, they can act as fomite transmitters. Ibig sabihin, theoretically, yung virus may stick to them and those hands and other parts of the body that might come in contact with those things ay maaari talagang madapuan ng coronavirus. Now, the problem with fabrics and yung shoes natin, they are more porous compared to the surfaces. Halimbawa sa mga tabletops and the metal surfaces. And you know that in general, yung mga more porous na surfaces, they tend to be a more efficient transmitter ng viruses in general. But trying to take a look at shoes, for example, and our pants, remember that these things, these areas of the body are not usually the things that we touch, di ba? Those are not high-touch surfaces. And so, yung risk of getting COVID from those portions of the body and parts of the clothes are actually lower.
We've also been asked about this many times. So, pag-usapan ulit natin. Dr. Roman, is it necessary to change clothes and shower after each time you go outside?
That is correct because that adds another layer of protection because having said earlier, di ba, that there is theoretically the risk of these things being fomite transmitters, it's always best for us to err on the side of caution to always practice infection prevention practices. So halimbawa, for me as a physician and as a frontliner, I always make sure that upon arrival at home, for example, and I use my work clothes, kailangan maliligo tayo at saka magpapalit agad ng mga damit na yan. Now, let me just emphasize earlier, I said that although the areas na yung pants natin and the shoes are low-risk areas, it's always best for us to always perform hand hygiene and hand washing. Diba? Those are proven strategies para maiwasan talaga yung pag-acquire ng COVID-19.
For those practicing social distancing, there are a lot of experts who agree that it's not really necessary to take clothes off or shower whenever you return home. If you are in close proximity or taking care of someone with COVID-19, doing laundry is an essential part of preventive hygiene, like what you mentioned earlier, Dr. Roman. And this includes high-risk individuals such as healthcare workers.
Exactly,
So now,
exactly.
Yes, that's
There are a lot of questions we have right now on social media, no, on the CNN Philippines Facebook page. Let's answer some questions here.
stay on our hair. What do you think, Dr. Roman?
I'm
Dr.
sorry,
Roman.
Doc. I did not hear that. Can you repeat that again?
Yes, of course. Ang tanong is, can the virus stay on our hair, sa buhok? Stay ba ang virus sa mga buhok ng tao?
Well, the straightforward answer is yes. But whether the risk is really high or very significant, that we don't know. But as far as we frontliners are concerned, di ba, one of the additional personal protective equipment that we use are the hair covers, especially dun sa mga di ba, sa mga female na healthcare workers who who go into the front lines when they take care of the patient is very important. I'm seeing the video right now. Kailangan itali ng maayos yung buhok para hindi kung saan-saan pumupunta so that it doesn't go in front of your face and get exposed to all the secretions. But Doc, more importantly, I want to emphasize that I see a lot of people na nag-grocery, for example, or in the public, and they are wearing the gloves. Supposedly, di ba, gloves is part of your personal protective equipment. But remember that these gloves, they do not really, you have to use them properly. Ibig sabihin, even if you wear your gloves and then you touch contaminated surfaces, and then I see a lot of people touching their hair and touching their face with their gloves, then yung purpose of using the gloves actually nawawala di ba? So it's very important for us na kahit naka-gloves tayo, if in case we decide to use the gloves, we always still have to refrain from touching our face and hair and mouth and eyes and always perform hand washing and hand hygiene.
That's correct. I agree with that. Now, keeping your bodies healthy should still be your priority in this fight against COVID-19. When we come back, we'll give you tips on how you can avoid bringing COVID-19 back home with you. Stay tuned to The Doctor Is In on CNN Philippines. Hi, I'm Dr. Freddie Gomez, and welcome back to The Doctor Is In. To prevent COVID-19 from entering our homes, we need to follow safety measures and at the same time boost our immunity. Infectious disease specialist Dr. Arthur Dessi Roman joins us right now. Dr. Roman, what are the simple hygiene measures that we can adopt to protect ourselves and our families from COVID-19? Okay, I think, Dr. Roman, we can't hear your reply. I think you're on
Sorry
mute.
for that. So let me just reiterate, Doc, that at this point, wala pa po talagang approved na antiviral sa COVID-19. Diba? There are newly released studies that would tell us that some interventions are actually effective. But at this point, it's really our immune system whom we can trust para labanan yung virus. Okay? So it's very important for us as individuals to invest on our own health para malabanan and ma-prevent yung pag-acquire ng COVID-19 infection. So having said this, it's very important for us to apply personal health strategies. For example, Doc, that's eating healthy, eating the right type of food, okay? Eating nutritious food and trying to avoid all of these things that would, alam mo yon, that will not really benefit but actually contribute to us developing chronic illnesses. We want to avoid fatty foods, we want to avoid salty foods, and try to shift our diet to something that's more nutritious. After all, these types of food are the things that will really give us the right nutrients, yung mga vitamins, di ba? Vitamin C, the micronutrients that will help us boost our immune system. I do get a lot of questions, Doc, kung kailangan ba ng supplements, di ba? There are a lot of supplements available. You have vitamins and minerals. But in general, if you are eating well, it's okay for you not to really take in these multivitamins and nutritional supplements. There are some minerals, for example, that when you are deficient because you are unable to eat this food properly, then you might have to take in some of these supplements. Otherwise, when you feel that you're eating good and you're okay, then you're good.
Very good. Now, Doctor, let's answer some more social media questions from our viewers. Marami talagang questions na pumapasok. Let's answer this one from Andrew. Mahilig pa rin ang mga tao na magsama-sama kahit may COVID-19. Mas mataas ba yung chances of transmission ng COVID-19 sa mga ganitong activities?
Definitely, Doc. Kaya nga po we are advocating physical distancing at this point. I think this is really something that's a bitter pill to swallow for us, especially Filipinos, kasi di ba mahilig talaga tayo mag-congregate, we want to eat at the same time, and our meal time is actually our chance for us to catch up with one another, nag-uusap-usap tayo. Unfortunately, when we let our guards down during these activities, then that's the opportunity for COVID-19 to infect us. Let me just share with you, Doc, no, na whenever we make rounds with our patients, di ba, we wear our complete set of personal protective equipment. But when we go out as healthcare workers into the general public and we are not wearing the complete set of personal protective equipment already, then that is another opportunity for us to acquire the infection. And this is not just true for healthcare workers, this is true for everyone. Okay? So as much as possible, yung atin pong mga ina-advocate na strategies to prevent the acquisition of COVID-19. Paggamit ng mask, that is important, di ba? You don't want to expose yourself from getting infected by the secretions ng mga possibly infected individuals around us. Okay, that's the importance of wearing a mask. But when you wear your mask, make sure that you wear it properly. Di ba, Doc? Kailangan when you wear your mask, kailangan covered yung nose, kailangan covered yung mouth, and covered a portion of your chin. Otherwise, kung bibig lang, then a lot of secretions can actually go into your nose also, di ba? So that's another route of transmission. Now, I also see a lot of individuals naka-mask properly pero hawak ng hawak. Diba? Remember that the outside portion of your mask is considered contaminated. Okay? So kailangan when we want to adjust the mask, for example, then we just try to touch the straps, di ba? And we don't touch the outer surface. And of course, after we adjust, then we have to make sure that we have to perform hand washing or hand hygiene. Again, congregation, let's try to avoid that as much as possible whenever we go into public establishments, mga restaurants, malls. Try to maintain a distance of 1 to 2 meters. There is evidence that the farther you are from an infected individual, then the chance of you getting the infection actually goes lower. So I'm seeing the video playing right now. I see a lot of establishments, 1 seat apart. Dati sa classroom lang natin naririnig yung 1 seat apart, di ba? During periodic examinations. But right now, I think I appreciate the efforts of all the establishments na talagang nagko-comply sila dun sa physical distancing recommendations. Doc Freddy?
Yes, that's very true. Now, I think we have time for one last question, and it is from Mark. Tanong ni Mark, kung nakakaramdam ng mild fever, pwede pa rin bang pumasok sa trabaho considering na mayroong pandemic?
Thank you, Mark, for that question. Unfortunately, during this time of pandemic, when you start to develop the signs and symptoms that may be COVID-19, of course, there are other diseases that can cause fever and respiratory tract symptoms, but you have to make sure that you're really not dealing with COVID-19. So the first onset of your fever, of your cough, your cold, your throat itchiness, it's best that you isolate yourself right away. Diba? You have to wear your mask and as much as possible, try to get in touch with your doctor and see if what is best for you to do. Can you continue doing self-quarantine and self-observation lang so that you don't get exposed to the hospital? Kasi you know that the hospitals are full right now and you don't want to add up to the burden. You don't also want any additional exposure sakaling the things that you're experiencing is actually not COVID-19, di ba? So for those patients na walang comorbid conditions, so wala namang ibang sakit, tapos the symptoms are very mild, it might be best for them to just stay at home and maintain the isolation, di ba? But for those individuals na mayroong comorbid conditions, may high blood, may diabetes, and you're not just experiencing fever, you're not just experiencing cough, but you're experiencing shortness of breath already. Nahihirapan ka ng huminga. You just went to the CR and then pagbalik mo sa upuan, hinihingal ka na, then that's alarming. Then probably you might have to go to the emergency room right away so that you can be properly evaluated and tested if there's a need for it.
Thank you very much, Dr. Roman, for joining us and sharing all those tips with our viewers. And I'd like to thank all of our viewers as well for sending in your questions. We hope that we were able to answer some frequently asked questions about COVID-19. I'll see you again tomorrow at 3:30 p.m. for our next session. I'm Dr. Freddie Gomez. Keep safe, everyone.